Hey, it's Wong here with Hands-On Therapy Services. We help people in the Miami area 40 plus stay active, pain-free, and avoid things like pills, injections, and surgery. It is April and it's Occupational Therapy Month, and if you are someone suffering from tendonitis of the elbow, sometimes called tennis elbow or lateral epicondylitis, and you're having a hard time writing, one of the things that we like to do is, first of all, if you have tendonitis of the elbow and it's bothering you, usually the pain comes and goes, and it's usually when people look for help is when they just can't take it anymore. But you don't have to wait until you can't take it anymore. You can actually come in quite early to get some help to get rid of it fast. But it's basically pain in your forearms. Sometimes it's very spot specific in a particular spot, and sometimes it's a particular spot in your elbow. Sometimes it just feels like it's all up and down your forearm. So if you're somebody who's suffering from some elbow pain and you need to do a lot of writing, one of the hardest things to do is to keep writing the way you normally write. Now, one modification that we can give you is, in order to write, you can switch positions in terms of how you're writing. So one way we do it is you can put it in between your fingers, and then that way you don't have to utilize these muscles as hard. And you can switch between this type of writing position and your regular writing position, just to help you modify until you decide what you need to do, get some clarity in terms of how do I get rid of this elbow pain so I don't have to keep trying to modify what I do, try to change what I do, so that you can do everything that you want to do, stay more active and be pain-free, and not have to take pills every single time or suffer the consequences of doing a lot of writing and then suffering later for it. So if you're someone that's suffering from some elbow pain and you want to get some clarity in terms of what you can do, give us a call, leave a comment, and I'll be more than happy to share some more tips and advice in terms of what you can do to get rid of your elbow pain so you can be more active and not have to think about, like, what I need to do to change.